Welcome everybody to this webinar on improved outcomes in numbing and pain reduction. My name is Dr. Sam Nedbal. I'm CEO and founder of Cryoconcepts. I'll be giving you a little bit of a lecture for a few minutes on some of the principles and how this all works, but then really excited today because Cecile Gandia has joined us. She's a practitioner who is working with clients every day using some of the products and technologies that we'll talk about. So we're going to bring her into the conversation as we go. And basically, hopefully, this not only gives you some of the background, but also the practicalities and the way you might be able to use some of the hints and learnings that come out of this webinar. So with that, let me start to move us through the information. So the topics in very broad brushes are threefold. One, we're going to talk about carbon dioxide in aesthetic medicine and specifically used with CryoTouch MD. However, this is not, the newest idea in how we might bring technology into aesthetic medicine, but rather the reuse of it in a way that maybe you've not seen before, especially when we talk about numbing pain reduction. Now, CryoTouch itself, I'll give you a brief overview of how this all works, and of course, then the impact on practice and what it means for someone who, day to day is seeing clients and challenged by the amount of pain that a lot of the procedures produce, but also the timing that it creates and how you can bring clients in and out during a normal workday. So just a few minutes of history. So as I said, this is not a new idea in a sense. I mean, for a long, long time, people have used dissolved minerals and especially carbon dioxide dissolved in water in these mineral baths, which were especially popular in Europe. Even today, if you're from Germany or France, the medical system will actually cover the cost of you going to some of these baths because they recognize the therapeutic value. Now, I'm not going to go into the textbook kind of review today, but there are peer-reviewed articles that have looked at the amount of carbon dioxide that can transcutaneously be absorbed in some of these baths and other devices that have been used over time. Usually it's just a very small percent, but that small percent has a profound effect on the superficial appearance of the skin and what it might do. Now, this was reduced also to practice back in the 1950s. There were a number of devices, I'll show you a picture in just a second, that were used routinely in practices. Now, you see the one here, which comes from an advertisement I was able to find. These things were solid stainless steel kind of devices. I think the woman's left arm is probably 2 sizes bigger in her bicep by the end of some of these treatments, but nonetheless, they were really popular. And of course, today we see carboxy treatments used very broadly. It's subcutaneously as well as topically. As I mentioned, back in the 1950s, there were a lot of these devices that were around. These were the two ones that I saw the most. The one on the left, the Carbotom, clearly marketing wasn't involved in the naming of some of these devices. But I actually have a few of these that I was able to find on eBay. The one on the right was sort of the big boy version of this, but they were really popular back in those days. Again, you can still find these devices out and about, more or less in shops or collectors, but they were very, very popular because what they did was something pretty simple. They basically were a spray of carbon dioxide that was simultaneously blended with a solution, which was generally infused with herbs or some sort of essential oils. You can see in the top left-hand side, how this is being applied. Now, I do have to tell you that these were at full pressure. So carbon dioxide, the technical specification is about 850 PSI. So that is really a lot of pressure. So whatever they were doing with the infused liquid, the carbon dioxide was just as much exfoliating and basically stripping the stratum corneum for sure. But a lot of the early researchers, and the one here I have is from an article by a Dr. Kovacs back in the late 1940s, recognized that there was a change at the surface of the skin as a result of applying these formulations with carbon dioxide. If you talk to estheticians or practitioners in aesthetic medicine from Eastern Europe, a lot of times they bring this up as like, oh, we did this all the time. Now they would have big tanks of gas under very high pressure doing it. So there was very little that was elegant about this, but it did get the job done, and it proved out the one idea here, which is the Bohr's effect and how it works. So again, the Bohr's effect is mostly talked about when we talk about breathing in oxygen and exchanging carbon dioxide for oxygen in our lungs. But that also happens at the surface of the skin. The Bohr's effect, if I apply carbon dioxide and there's hemoglobin nearby that's carrying oxygen, will also cause a change in pH, which is going to result in the release of oxygen. So it's a really simple idea that has a long time merit in the medical community, and of course is used in different ways. And so, you know, what we've done with CryoTouch is basically try and bring this into today's world in a platform that is now the CryoTouch MD. So this gives you some general features of what it looks like. You know, there's one next to me right now, and we'll look at some other images and pictures. We'll talk to Cecile about it in just a minute. But here it's the idea is there's a tank of carbon dioxide, which is screwed into each one of these, locked in place, very safe procedure. And then the handle itself is what delivers the cosmetic formula, with the gas mixing with it to help deliver it in the end. There's a cartridge that will contain the formulation. Each cartridge is tagged, and so from an electronics perspective, when I put it in, the CryoTouch knows, okay, this is this formula, this is what it's for, this is how long it's going to run for, this is the temperature I'm going to allow it to get to. So the instrument itself really controls the whole process from start to finish. And so the idea when we developed this was that we would have basically a menu of items that go along with these features. So if you look back in the literature, carbon dioxide itself does a whole bunch of things in terms of pain, oxygen release, new growth, and stimulation. So all of those are well documented. But now you start to bring in other ideas, and this is really in aesthetic medicine, the import of what CryoTouch is and does. So, you know, some of the other formulations that are available with this look at anti-aging, wrinkle reduction, pain and redness reduction, which is what we're talking about today. We also have developed for the system a botanical formula and program that works on hair growth, hair density. Again, not the subject of today's presentation. And also, we're just in the process now of introducing basically an empty cartridge into which you may put your own formulations. So this rapid delivery cartridge idea is in our beta tests right now and should be available shortly. So again, if you're interested in any of this, please ask at the end. There's some information that and ways you can contact us. So let's talk specifically today about numbing. So you know, it's one of these hidden things that every practice goes through, and nobody seems to want to talk about too much other than we don't have a good solution. And why numbing? Well, you know, I would say as a generality, most people expect when they come in for aesthetic treatments, there's going to be pain involved. The old no pain, no gain really lives in aesthetic medicine. And so we see a lot of lasers, needling, RF. Just think about almost any technology, and if it doesn't hurt, actually people are like, almost like, why am I not feeling anything? It should hurt. It's somewhat trained into those who use aesthetic medicine routinely. But from a practical perspective, every practice that is doing these painful procedures runs into a brick wall, and that's, you know, related to wait times. How long does it take for the numbing to take effect? And if there's too much pain that you can't overcome and protect from, then the clients often won't return for additional sessions. So Why numbing? Well, it's not, you don't directly charge for it, but indirectly you do, because if it takes more time, if the patients don't come back, all of that was basically a cost. And so we focused on this with CryoTouch. We think about it in two ways. And again, we named the cartridge for this Rapid Numb, and we have two different sizes that are worth mentioning. One is 300 seconds of treatment, one is 200 seconds of treatment. This formula is a 5% lidocaine, but most people will either use that directly or they'll combine it with their own pharmacy product that they bring in. We'll talk about that in just a second. So some of the high intensity pain that we talk about might be plasma pen, various lasers, RF microneedling. Low intensity could be microneedling, chemical peels, permanent makeup, injectables. You know, you can lump it in those two different buckets and have procedures that go along with that. Now, getting to those procedures, let's now bring in Cecile. And I want to welcome you. As you can tell, I've ripped off some of your images from your various social media, but it's really, as we were talking about before we started the webinar, you know, it's really interesting when you look at you as a practitioner and the way, you know, you built your life into this practice and the people and the smiles and everything. I couldn't help but take the one in the top middle that has the CryoTouch MD in it. So thank you for doing that. But still, let me welcome you. I mean, would you mind just taking a moment to explain kind of your training and what the practice does?
Yes, so I am Cecile Gandia. Thank you for having me. I'm a physician assistant for 21 years. I have always wanted to do aesthetic medicine. It's a hard field to get into. I trained with Dr. Carruthers doing Botox in 2004 in Vancouver, came back to Virginia, and they just weren't ready for aesthetic medicine, I guess. So I've been doing different things throughout my career. I've even done hair transplants for Bosley. And finally, I was able to get into the aesthetic field for the last 3 years, and I finally opened up my own place 6 months ago. So I'm in a small salon suite by myself as a solo provider.
Yeah, no, and that again, you know what I think everyone can appreciate is how many small businesses are out there that are doing that. And so for you, you know, if you look at, well, do you want to describe some of the procedures you may be doing that have challenges with pain management?
Absolutely. So I have two RF microneedling devices. One's a little more intense than the other. I have a lot of my patients do the skin pen microneedling. Even I've used the CryoTouch for lip fillers. It's actually done really well for that. So various things, but particularly skin pen took me the longest because I would have patients sitting in my one room 45 minutes just waiting for numbing, and you know, it'd be more convenient if I had two. But so I was trying to find a way to maximize my efficiency that way, and I stumbled upon CryoTouch, so it's been great.
Oh, that's awesome. So what did you do before you found the CryoTouch?
So what we do traditionally, I have compounding pharmacy that I use that has two different ones. I sometimes will use a lidocaine, like a BLT, that's like a 20-10-10%. I also have a lidocaine 23/7. You traditionally would clean their face, leave it on their face, and depending on the procedure, there's like the severity of the discomfort, you would leave it on minimum 30 minutes to an hour, depending on the discomfort level of that particular intervention.
So if someone's not adequately anesthetized, you know, how did you handle it, or what did they do in reaction to that? Did you ever lose folks coming back for their additional treatments?
Yes, like particularly lips. That's one that people are like, I'm not going to come back for that. I mean, there's other methods for me to help with their anesthesia. But this has been surprisingly something I didn't think about using, but a patient actually recommended it because she's used it for her skin pen treatment. She's like, could you just use that on my lips? I'm like, okay. So I think that was a kind of a game changer and something I didn't even think about using it for.
Yeah, it's interesting. So you started to talk earlier about kind of where you prefer to use this in procedures. Would you mind describing then the CryoTouch procedure and how, maybe a little bit of a kind of a step-by-step?
Sure, absolutely. So what I normally do when I see the patients, what's now changed versus what I used to do, is I'll put a very thin layer of my compounded anesthesia, whether it be BLT or the lidocaine tetracaine, put it very thin. Before I would probably kind of goop it on and be really goopy and droopy, like going all over their face. I just do a very thin layer. I let that sit while I set up the CryoTouch. CryoTouch is very easy, very intuitive. You just press the button, it loads, and I use the Rapid 300, and they've probably been sitting there for 5 minutes while I set that up, and I use a CryoTouch. It counts down 300 seconds, and then they're done. It's amazing. It's really easy. I mean.
That's great. Any hints or tricks you've learned along the way in terms of using CryoTouch with your
Yes.
compounded formulas?
Yes. So with the depending if your compounded formula is like a plasticized ointment base or a cream base, using that with the Rapid Touch, because the Rapid Touch is also spitting out some product, it can get a little messy. I have my patients close their eyes. I will sometimes, when I kind of prime the cartridge, I'll have like a gauze to kind of take the first initial hit of the solution there, and then I would go all around the face. Another trick, which I didn't realize, is that you don't have to hold the button the whole time. I was holding the button. I was like, man, I'm going to have Popeye arms, but it's working. Patients are happy. I'll just deal with it. And it was burning. And then one day I realized that I could let go. I was like, I was going to tape it. It's kind of like when you're at the gas station, you have to hold it.
Yeah.
But that's a good trick. I did not know that you don't have to hold it down the whole time. So it made it so much easier. And so it's very ergonomic that way now that I don't have to hold the trigger down. I could go any other way. So it's great. And patients also they also say they like it. They feel like it's an extra treat because it's cold. It's like a massage. And I'm not an esthetician, so they don't get that. So they feel like it's an extra added part of their experience too.
Yeah. Do you, and again, I don't know the answer to this per se, but do you treat men and women with CryoTouch?
Yes. I actually just did my 16-year-old son, and he's kind of a baby when it comes to pain. So I was really anxious about it. My daughter's a lot better with it, and he thinks that it really helped a lot. He felt nothing when I did his Clear and Brilliant treatment. So I used it with him, and it was great. And what I like about it, say you do have 3 rooms and you could just put a patient in another room to numb and sit while you see 2 more patients. Even when you let the numbing sit, it can't really get in the hairline well. And I feel like the CryoTouch, what I like about it is this is the most, most discomfort for most patients is over the bone, near the hairline. You're not getting the numbing well, and it's able to infuse it better here. And so that's something that my patients mention. Like usually I feel the outside, like the peripheral of my procedure, and now I don't because of the CryoTouch.
So if you don't mind, what areas have you used to numb with CryoTouch, and are there any areas you've stayed away from?
I've used for the whole face. I've used the lips. I just tell them to keep their mouth closed. And but another thing I didn't realize with the Rapid Touch 200, I mean, your cartridges are so intuitive that it doesn't, the pressure is not as harsh. It's actually softer. So I don't have to worry about them like getting some of that in their mouth, because the 200 is a lot more gentle than the 300 when it comes out. And I just, like I said, like close your eyes. I've used it on the body. I've used it on the stomach. It's been fine. And the patients, I'm like, what does the lip thing feel like? Because I'm just going around here, and usually I'm all around. They just said it feels like a slobbery kiss or like kissing a goldfish or something. But in my one patient was like, I feel nothing after a lip filler when I was doing her lip filler. And I was so surprised.
Yeah, no, it's awesome because they're so much more comfortable. I think a few weeks ago, someone from the field had sent in, somebody had it, the CryoTouch treatment around the lips, and they were drooling because they just couldn't feel anything. So now, so let's segue while we have just a couple more minutes. So what is, you're a small businesswoman. By the way, congratulations. It looks like based on the website, you're up for a number of awards, which is great. No, that's a testament to the hard work that goes into building what you're doing now with your practice. What has CryoTouch meant to you in terms of your practice, your economics, anything along those lines?
Yeah, it was able to, number one, add more value to my patients, but also make the experience a little more fluid, and expedite treatments. Before, I used to budget like 120 minutes for some procedures because I have to budget time for numbing plus the procedure. Now I could get it down to 90, sometimes 60 minutes. And so that also means that I could put more patients in. So, financially, it's really helped me a lot because right now I'm booked out like a month, and now I'm able to add more patients in because of the CryoTouch. That's been great. Like I said before, I would have 2 rooms I could bounce, but now I'm just in 1 room for now. And now I'm able to maximize my time without having to invest in another room or get an assistant or have patients wait out in the waiting area. So it's been really great. And I was also able to add value added things on top of it. Like, because they're so numb, now I'm able to stack treatments, which I like. So I use a Clear and Brilliant, and then I do Skin Pen, and I was worried that they would feel it, and they stayed numb. And they said it was comfortable as if they just did one of the treatments.
That's awesome. Well, one of the things I'll point out, because again, I know we're talking about your practice, but one of the things that's come from other practices as well is there are differences if you do a compounded formula. We do have some that we could point you to that we know are well tested and really do a great job. There are others that we've seen with people that are more petrolatum based, more oil based, that don't work as well. So it is important that if you're going to couple this with a compounded formula, that you pick the right one. So don't hesitate to reach out on that. And that's kind of going out to those who may be watching this video at a different day and time. Okay, so we talked about your patients, the procedure that you're using, where and how you're using it, what it's meant to the practice, which is great. That's the best part when you develop something like this. You want to see it become a practical thing for people to use. Is there anything else that you would say to people who may be considering this, or anything you'd like to finish up with?
Yeah, I think as a provider, whether you be like an injector like myself, an esthetician, anyone that does procedures that involves numbing, that's always something that's kind of stressful. It's one thing, like, how are we going to maximize our time? And I think this is one solution that really has helped my practice. Like, it's been a game changer to be able to numb that quickly and efficiently is what's the most important thing. Like, it's not only quick, it's very efficient. Patients are more comfortable, they're happy. Plus, I could see more patients. It's been amazing.
That's awesome. Thank you. And by the way, thank you again for coming on to this webinar today. I know you have a busy schedule. Now, absolutely. I'll tell you that in the last couple slides, we've included, some general protocols. We wanted to hear Cecile's, but these are ones that we've seen from others. And so again, if you watch this in the future, pause, write down, or ask us for a copy of the slides, we're happy to share those with you. And so as we summarize and come to the end of our time, again, CryoTouch, very different platform, uses technology that's been in aesthetic medicine for a very long time, but never quite delivered this way. And so it's all about the delivery. And when we combine that with formulations, we see all kinds of benefits that come out of that, for numbing, for general anti-aging treatment, for hair, and even an empty version that you can run your own formulations or other specific formulations where you're interested in bringing the benefit of carbon dioxide. So, Cecile, I can't thank you enough for joining us again today on this webinar and just sharing your experience. Really happy for you that it's had those kind of results. If people want to reach back out, ask more questions, here's a couple different ways that you can get to us here. And again, we'll thanks Cecile one more time. And again, thank you all for watching this.